So one of the interesting things about anti-angiogenic agents is the fact that they increase tumor blood flow. So on the one hand, we always think that anti-angiogenic will decrease blood flow, but it increases blood flow. So the tumors are more exposed to oxygen, nutrients, and immune cells. And an increase in tumor oxygen will ultimately cause, for instance, the immune system to become more effective. So tumors do, to an extent, better when they are hypoxic. So we increase the blood flow in the tumor via anti-angiogenic agents, and that's is going to have a beneficial effect on the immune cells, but also on the delivery of chemotherapy. Radiotherapy will work better when tumors are having a higher oxygen level.
So VEGF is the most important target for angiogenesis, and we can target VEGF through at least 3 mechanisms. The first one is targeting the ligands, and we know that we have 5 ligands, VEGF A, B, C, D, and the PIGF. Then we can target the receptor, and we have a family of receptors which are the 1, 2, and 3, and maybe the second is the most important receptor for the pathogenesis of lung cancer. And we can also use tyrosine kinase inhibitors targeting the downstream of the receptor. So now we have at least 3 possibilities to target in the angiogenesis. So we have at least 2 strategies to target with monoclonal antibodies. One strategy consists in targeting the ligand and mainly the ligand A, and the most famous drug and approved drug for the treatment of non-small cell lung cancer is bevacizumab. Then we can target also the receptor. This is the case of the VEGF receptor 2, and this is the case of ramucirumab.
The anti-VEGFR TKIs are inhibiting the intracellular domain of the vascular endothelial growth factors. The most important is the vascular endothelial growth factor receptor 2, but there are a number of them, and this is the way that are acting, inhibiting this intracellular domain of the receptor. Bevacizumab is acting in a different way. Bevacizumab is inhibiting the vascular endothelial growth factor, so the ligand.